Today is World Heart Day. World Heart Day is annually observed on September 29th around the globe in an effort to raise public awareness about cardiovascular diseases, their prevention and global impact. Cardiovascular diseases, also known as CVDs, claim the lives of around 18 million people each year, and it results in 31% of all global deaths. To tell us more about this important day, here is Dr. Marlon McKay. So Doc, why is this day so important?
Well, it's so important because your heart is so important. Imagine without your heart you can't function. In fact, you'll be dead. So keeping a healthy heart is very, very important in terms of our day-to-day well-being, living a healthy life. And so World Health Day is really about raising awareness, what it means to have a healthy heart, how to keep your heart healthy, and how to prevent what we call cardiovascular disease.
Okay, so what are some of the things that can affect your heart?
So there are many, many things. Some things we can control, some things we can't control. For instance, some of the things that we can't control is if there is a history or family history of heart disease. That's really out of your control. If your mom, dad, brother, sister has already had a cardiovascular event such as a heart attack or stroke. But most of the other things are totally within our control. For instance, what we eat, the amount of exercise that we do, whether we smoke or not, our weight, our cholesterol levels, our risk of becoming diabetic. So all these things play a role in whether we will have a healthy heart or
not. A question that's asked quite often, how do I know if I'm having a heart attack?
Yeah, so that's a good question. Sometimes it can be quite easy. The classical method sometimes can be a little more difficult, especially in women, in certain places where the symptoms may not be sort of from the textbook. But the main symptom of a heart attack is always pain, chest pain, and it's usually central pain. It's a heaviness. It's described as someone sitting on your chest, like an elephant sitting on your chest. The pain may radiate up to the neck. It may go down the arm, usually the left arm. It may be associated with sweating. It may be associated with extreme pain. So the patient will say 10 out of 10 type of pain. Sometimes it may even feel like heartburn, like acid reflux. So one has to be careful to distinguish what type of pain it is. And what we usually say is, if you are unsure, any chest pain is always serious until proven otherwise. So if you do get pain that you cannot explain, rather get to your doctor and have an ECG, have a checkup, and see if it could be your heart.
And a similar one, how do I know if I may be having a stroke?
Yeah, so a stroke is sort of a lot easier to elucidate the symptoms. Remember, a heart attack happens in your heart, and a brain attack is a stroke, so it happens in the brain. And the symptoms we remember very easily with the mnemonic FAST. So F stands for face. So if the face is droopy or pulling to one side, plus A stands for arm. So if the arm is weak, if the arm can't move together with the leg, and it's usually the arm, the leg, and face on the same side. And then S stands for speech. So if the speech is slurred, if the speech is kind of difficult to understand. So face pulling, arm weak, and speech different or slurred. Those things stand for a stroke. And the T stands for time. Time is of the essence. Call the emergency services. ER 24 084 124. Netcare is 082 911. Have those numbers at hand and get whomever you think is having a stroke, get them to the emergency department very, very quickly.
Okay, so what are some of the things we need to do to lower our risk of a heart attack or stroke?
So this is very important, and it really comes down to our lifestyle. It starts in the kitchen, what we eat. We need to keep a diet that is fresh, that is healthy, at least 5 portions of fruit and veg every day. We need to limit our carbohydrate intake. We need to increase our water intake. We need to make sure that our food is fresh, that it comes from a tree and not from a fat tree. We need to make sure that we are exercising, keep moving. Exercise at least 30 minutes a day for 5 days of the week. Then we need to know our numbers. You need to know your weight. You need to know your height. You need to be able to work out your body mass index together with your waist circumference. You need to have your sugar checked regularly. You need to have your blood pressure checked. You need to know what is your cholesterol. And I think if you know those numbers, live healthy, eat healthy, 7 is heaven, get at least 7 hours of sleep per night, you are going a long way in terms of preventing your risk of having a heart attack or stroke. So to summarize, World Heart Day, very important day on the World Health Calendar. Make sure you know your numbers, make sure you have your heart checked out, see a cardiologist if the risk is high, and let's live a long, healthy life. Thank you very much for watching. Bye. Good night.